Hi everybody. Today we are talking about managing illnesses and medications for yourself or for an aging parent. Caregivers have been sending me messages and talking about increasingly helping elderly parents with their health conditions who take a lot of medications, and they're asking for processes or steps around these tasks, especially if this is something that you've never done before or your parents' health conditions are growing in number, and all of this is getting much more complicated. So in this video, I will respond to the question of how do I manage illnesses and medications for elderly parents, or do this for myself if I'm the person with the health condition, and what are the things that I should know that I may not know. A lot of caregivers benefit from having systems or processes or step-by-step plans to care for loved ones to address all of these health concerns. But the problem is, if you are new to this or you've never had to do this before to the extent that you might be now, it might be a little bit of a challenge. So I'm here to just give you some ideas about step-by-step plans or processes that you can create, which I have used myself in managing care for older adults and working with caregivers. These are skills really that once you learn them, they apply to your caregiving work, but really all other parts of your life. And so specifically for this video, we're going to talk about managing a chronic disease or an illness, and this applies to any illness, and then managing the medications that a parent takes and looking at all of the unexpected side effects and things that might be caused by the medication, that might be some unexpected things, so that you can kind of investigate any side effects to see if maybe this medication isn't the best and doctors should look at something else. So in all of this, kind of like creating plans, if you've never done this before, if you feel uncomfortable, can be something that we put off, right? Or we delay or we procrastinate about because we don't know how. So this video can help you even if you are a caregiver who's done this a million times. Maybe you're saying, I don't have time to do this, I'm too busy. At a minimum, it will give you something to think about that may help your current situation a little bit or may help a lot. Because honestly, if you don't have plans or systems to help yourself or parents or loved ones, you might feel like you're in this hamster wheel where things are just spinning and spinning and spinning, and you get to the end of the day and you're like, oh my gosh, what have I got accomplished? Nothing. Or you just feel stuck. So if you want to feel good about what you're doing, be proud of what you've accomplished, and learn a couple of tips to help you care for parents with complicated health conditions who take a lot of medications, stay with me because I'm going to help you create this process, move by it, and be able to just manage all of this more easily. So if this is your first time here, I'm Pamela D. Wilson. I'm a caregiving expert, advocate, and speaker. Information about me and my professional career is linked below in the comment section. Please like this video, follow my channel, comment, share it with others. Even if your comment is only to say, hey, thanks for the video, your participation helps people all over the world find these videos who are seeking similar information, help, hope, and support. So, caring for a parent, have one condition, two condition, 10 conditions, 2 medications, 5 medications, 10 medications. Don't wait for tomorrow or next week or next month to start. Today is the perfect time to look at this. Talk to your parents, find out what they're worried about as far as their health, or look at changes that you have seen in their health that you're saying, you know, mom and dad used to be like this and it's been such a huge change. It just doesn't seem right. This doesn't seem normal. So here's kind of how to get started if you're stuck, right? It's really giving yourself a deadline. So when we look at life, a lot of us kind of put off things until some disaster strikes, right? You have a flat tire on the car, you knew that you needed new tires, and you just let it go, right? Or like, go back to your school days. How many of us waited until the last minute to complete that project? Or maybe today even, you have a project due tomorrow that you haven't even started on as of this minute. You have this deadline and you haven't started. We tend to just do this. It's part of life because there are so many things coming at us that are, grab our attention, or the shiny article, or whatever, that we put things off. And so in thinking about helping elderly parents with their health, there really can be a deadline that you don't see. So let's say that maybe your parent has a heart problem and they're not taking their medications. Might they have a heart attack? Might something else happen? There are these things out there that we cannot possibly know that are going to happen, or cannot possibly estimate. Because if we knew about them, we would do something about them, right? But the reality is, with aging parents and health, unexpected things happen all the time. And then we think, gosh, should I have known about this? Well, maybe. So schedule time now to talk to your parents about their health and their medications and what's going on. Even if it's 10 minutes a day for 5 days, or 30 minutes a day for 3 days, or you go over there every weekend for a couple of hours and you start working on this together and putting together a plan. So the thing is, where do you start, right? Well, do your parents know what their health diagnoses are? Do they have a type list of their medications, or just bottles all over the house, and they're taking this one, but they stopped taking this one, and they have bottles that are like 2 or 3 years old, and you're trying to figure out, like, what are they taking, right? You have to start somewhere. So make a list of where to start. Health conditions, medications, changes in your parents' health. And so let's just use an example of type 1 diabetes as a health condition. Now, your parents' health condition could be a heart condition, or arthritis, or breathing problems, or whatever. This will apply to everything. So first of all, you or your parents want to understand what the condition is. So if it's type 1 diabetes, what are the signs or the symptoms? So what does your parent look like when they feel really good? What do their days look like when they feel bad? Do they feel dizzy or tired? Do they get thirsty or have to want to eat something to make them feel better, to either raise or lower their blood pressure? When they take their insulin, do they feel better? Do they feel worse? How does all of this work on a day-to-day basis? So how does your parent feel? And then the second part is, does your parent realize the activities that cause them to feel better or worse? And do they understand the short-term effects of the condition and the long-term effects of the condition? So just something really simple, right? That applies to all of us, whether we have health conditions or don't. Let's say that you don't get a good night's sleep. What happens? You're probably tired the next day. You may not be as focused or effective at work. And then on the other hand, let's say you get a great night's sleep. Wow, you're up, you're out, you're doing all kinds of things. And then let's look at somebody who is active. So maybe you're a person who exercises every day, even if it's only to go for a 3-mile walk, or you do some weights or something, right? But you make sure you do something every single day. Versus person over here who all they do is sit in a chair all day and watch TV. And the place that they eat is in that chair in front of the TV. Whose energy level, whose mental outlook up here do you think is going to be better? The person who gets a little bit of exercise, or the person who basically lives in a chair in front of the television all day? I would say it's going to be the active person, right? So along with health problems and taking medications, there can be a lot of frustrations because these medications can have side effects. And so how do you know what's causing what? And is your parent taking another medication to address the side effects caused by medication number 2 or medication number 1? And how do you know? Well, you schedule an appointment with the doctor. And for people over 65, the best appointment to get the time that you need is the annual physical or annual Medicare appointment, right? Because it's longer than 15 minutes. At that appointment, the doctor will go through every single medical condition. And you can ask about the medications associated with those conditions. So if it's high blood pressure, what's the blood pressure medication? If there are circulatory problems in the leg, what medication addresses that? How do these two medications work together? So let's kind of go back to the diabetes, type 1. Your parents having a lot of problems doing finger sticks because they hurt and they don't want to do it. And then after they do that, they got to calculate some numbers to figure out how much insulin they have to take. There's long acting and short acting, and it's way too much for your parent to manage, so they're not doing a good job. So as a result, they don't feel good all the time. It's just too complicated. So would your parent qualify for one of those things you see on TV? It's a continuous glucose monitor that's placed on the skin, and you take a cell phone, you put it up to the monitor, and it tells you what the blood sugar reading is. So instead of having to do finger sticks 3 times a day, you have this little apparatus, right, placed on your skin, which does have a needle in it, but it reads your blood sugar. So that might be one solution to a parent who's like, my hands are horrible, my fingers, I'm tired of sticking myself, I don't want to do this anymore, it hurts, I don't like it, right? So problem, solution. Then the next part is, along with that, there can be an insulin pump. So again, for people who don't have a glucose monitor and don't have an insulin pump, there's a lot of needle sticks, which, people either get used to or it just becomes something they don't want to do. And so they don't feel as good. Well, would your parent qualify for that glucose monitor? Would they qualify for an insulin pump, which again can deliver the insulin they need without another needle stick, right? Now, again, there's a needle stick to put the insulin pump in, but it's not like 3 needle sticks a day. So let's say that you get that solved and you feel like your parent can use the monitor, use the insulin pump, know how to use all the technology. That could be life-changing for your parent. It could just change their health overnight to where they feel so much better and they're doing all the activities they used to do and they feel good. So other things for health conditions that you can do. There's a lot of education out there at what I call disease-specific organizations. So the American Diabetes Association, the Alzheimer's Association, the Parkinson's Association, American Cancer. There's a lot of information out there. And obviously people spend a lot of time searching on the internet, but sometimes if you call a local association and you can make the time to stop by, you can actually meet with somebody who could share a lot of information right away. And so your learning goes from like 0 to 100 in an hour, right? And then in addition to that, you might find out about maybe support groups for people with diabetes or activity groups for people with diabetes or with heart problems or with Alzheimer's or cancer or other health conditions, kidneys, dialysis. Support groups can be great if they are positive support groups, okay? So if they're encouraging and motivating and positive and they're not just, oh, woe is me. So, by the way, I have a caregiver support group. It is called the Caregiving Trap. It's on Facebook. Below in the comments section, there is a link where you can find the site and request to join. It's a private group. So if you look at the effort that it can take to really learn about a diagnosis and the short-term effects of the diagnosis, how you can manage it better, and the long-term effects of the diagnosis, you really can get ahead of the diagnosis so that the health of your parent is not going like this, right? So that maybe it started to go like this and now you're like leveling it out, right? Because you have all this other information. Now, admittedly, this takes some time and some effort, which is why I'm saying schedule time, make the effort, go talk to the doctor, find out how all of this can be managed better. And hopefully your parent is interested in improving or managing it better. If they're not, that is a different story for another video. So now let's talk specifically about medications, prescription medications, and then all these over-the-counter supplements that we see advertised on television. So any medication can have a lot of side effects. So if you see the latest, greatest commercials on TV, you see people dancing around and having a good time, and then there's this voice underneath that talks about like all the side effects, because there can be a lot. And there can be more side effects for older people whose bodies may not process medications as well. Maybe their kidneys are slower, their liver is slower to eliminate toxins, and so a medication that works well for one person may not work well for the next person or yourself or an aging parent. So going back to looking at your parents' health conditions, what's the most significant one? So if you can rank them like in order of importance, number 1, 2, 3, 4, 5, and then match up the prescriptions 1, 2, 3, 4, 5. And then look at how has your parents' day-to-day condition changed? Are they experiencing side effects? Like, are they more mentally confused? Have they lost weight? Do they have heartburn or stomach upset so that they're not able to eat what they used to eat? Are there any type of effects on their muscles? So some cholesterol medications and some blood pressure medications can cause muscle spasms or muscle cramps. And if you don't know this, you don't know to go back to the doctor to say, I started taking this medication and I'm having all these things going on and I don't like it. What can we do? Can we change the medication? Then there's medications that can cause constipation, or maybe you don't sleep well, or maybe your parents are sleepier all the time. Maybe they have become apathetic so that they don't even care. Depression medications can have that side effect where people kind of just don't care. They're not motivated. They don't want to do things. Okay. That's the wrong depression medication. There are other depression medications that don't cause that. So it is really, really important to look at when a medication is prescribed. What happens? What are the changes? And my recommendation is don't start 3 at the same time. Start 1, look for side effects. If there's no problems, then start the second, look for side effects. Because what can happen is if you start 3 at the same time, you don't know which one is causing the problem. And then sometimes a doctor will prescribe a medication, and then they prescribe another medication to deal with the side effects of medication number 1. So, best way to do this, again, schedule that annual wellness visit where you can talk about the diagnosis that your parents have and then go through every single medication. You can even go to the extent to say, well, hey, is there an older medication that's less expensive? My parents paying $50 for this every month. Is there something that works just as well that is not the latest and greatest and most expensive thing that's advertised on television? And then to combine all of this, right? Ask the doctor to explain any past blood work tests that your parents have had. So if they're on a medication for high cholesterol, well, how high is it? Is it possible for your parents to make changes in their diet to bring that number down? I know people who have brought their cholesterol down and their triglycerides down and their blood sugar down without taking medications because they were willing to modify their habits and what they ate and exercise more. So medications are not always the only answer, which is a question that everyone should ask. So let's say that you met with a doctor and you're good. The other thing to ask about is the effects of medications and over-the-counter products, because some of those can have some serious, they call them contraindications. There can also be interactions between medications and food. So, for example, for people who are on coumadin, which is a blood sugar, grapefruit juice is kind of off the list. You shouldn't drink grapefruit juice if you're taking coumadin. Some blood pressure medications can reduce calcium and magnesium in the body, and so a person should take a calcium supplement or another supplement to counteract what the blood pressure medication is doing. So those are other questions to ask. And then let's just even take it a step further. So let's say people who are undergoing chemotherapy take a lot of medications, right? Well, there are a lot of side effects to those medications. And just a simple one that is rarely discussed, right? So folic acid can have an interaction with some chemotherapy medications. Now, the doctor may not mention that because if they see what you're taking and there's nothing that says taking folic acid, right? They may not pay attention to it. But did you know that folic acid is in most multivitamins? And so if they don't ask you specifically, are you taking anything that has folic acid in it? You may be, and then you may have all these bad side effects and not realize it until later. And you really wouldn't have had to have these side effects if someone would have thought to ask that question. So this is kind of where patients have to be very proactive to say, what are the 10% of side effects that people get that you don't normally talk about? Or are there vitamins or over-the-counter supplements or foods that interact with these medications? Now, you can even ask your pharmacists this. So pharmacists are probably some of the most undervalued people out there. They can talk to you about medication interactions. They can give you more information than probably even your doctor knows about the medication. They can put notes in your file saying, you took this medication and you had a bad side effect, so don't prescribe this again. Because sometimes doctors, if they don't know, if that's not in your record, they're going to write another prescription, and the pharmacist is going to say, oh, no, we got something in the file here that says we have to ask about this, or this may not be good for a patient. So I also recommend, in addition to going to the extent of, looking at the chronic illnesses, looking at the medications, looking at side effects, looking at supplements, make sure you talk to everybody about all this, but use your pharmacist as another source of information. So if you're picking up meds for your parents and you've got a power of attorney on file or some permission document that says you can ask the pharmacist questions, do that. Because how many times when we pick up a medication does the person who's ringing you up say, do you have any questions for the pharmacist? And most people say, I don't. Well, be the person who says, I do, and then have some questions to ask. That can make a huge difference for the health of your health of your parents, health of anybody that you're taking care of. Being thorough with all of this makes so much of a difference that sometimes we can't even imagine. And yes, it does take time. Yes, it takes attention to detail. Yes, it takes asking questions and knowing the right questions to ask. But honestly, you might be surprised if you devote just, a few hours to this every week for a month, for 30 days. The positive results that you might be able to see when you're helping a parent. So other simple processes besides, managing meals and medications that help parents feel better. Well, it's nutrition, right? So could you or somebody visit your parent one day a week, make a week's worth of meals, freeze them. what's involved? Well, you got to plan the meals, know what your parents want, go pick it up at the grocery store, make time to make it, put it in the containers, freeze it. Another thing with regard to all of this is setting up medication boxes, which I know a lot of people do. But if you haven't, and your parents have bottles all over the house and they don't know what they're taking, and your mom's taking your dad's medications and your dad might be taking your mom's medications, it happens, believe it or not. Setting up separate medication boxes for them. So all I have to do is flip the lid. It's the morning, I take these pills. Flip the lid, it's noon, I take these pills. Flip the lid, it's evening, I take these pills. That can help your parents feel better because they're taking their medications on schedule, on time. Yes, it takes a little bit of time, but the benefits are huge. Another project might be, if your parents are in and out of the hospital a lot, have a go bag, right? A bag with a list of your parents' medications, their health concerns, past hospital visits, insurance cards, ID cards, all that. So if your parent does have to go to the hospital, they just take this bag with them. You're not having to get the call saying, I'm going to the hospital, and then they leave, and then you have to run to their house to pick up all this stuff, right? Just have something that goes with them. The idea is to make all of these care tasks less stressful by having some kind of process or some kind of backup plan or being thorough as you go through it, because all of this can become more routine and less stressful, which is what all caregivers want. You or the person that you care for will feel a little bit more in control. Not that we can ever be 100% in control of anything, but the benefit is that your health, even if you're the caregiver, you're going to be less stressed. The health and well-being of your parent can benefit from all of this interest and more attention, and they can feel better, and then they can need less of your time. So to kind of summarize all this, prioritize your parents' health by which condition affects them the most. So 1, 2, 3. What medications are they taking? 1, 2, 3. What does their blood work look like? Are there any side effects or interactions? And kind of put all of this together and then look at other things that can affect this, like nutrition, like taking medications consistently, like regular doctor appointments. Because what I can say is once you get a handle on this, you have some processes, you have some systems, it will greatly reduce your stress level. So I'm Pamela D. Wilson. I am a caregiving expert, advocate, and speaker. You can learn more about me, my professional work life, by clicking on the links below this video. There's also information about articles on my website, my caregiving programs, my podcast, The Caring Generation, my book, The Caregiving Trap, my caregiver support group on Facebook called The Caregiving Trap. And please do like, follow, share my channel, share these videos with other people all around the world so that we can help people find the support and the information that they need to feel better and live happier and healthier lives well into old age. Thanks for being here. I will see you all again soon in another video.